Welcome back, everybody. We are going to be talking about the services that we can find both in the public and community health settings. So first of all, I want you guys just to be aware of what helps determine the health of a population, because it's really important to understand the health determinants within public health setting. So you can see here that there are several components. We have social and economic factors. This is the purple portion. It's located right here. This makes up about 40% of the health of the population. So the vast majority is going to be based off social and economic factors. Health behaviors make up about 30%. Clinical care right here makes up 10%. Physical environment. And for some reason, we're missing a title here, but genes and biology, this is another 10%. So genes and biology, physical environment, and clinical care together make up another 30%. All of these put together are going to be determinants of how healthy a population is. So we are going to specifically focus on the different services that are available to the public in general. We're going to start at the top and work our way down to local resources. At the very top here we have the World Health Organization. It is organized by the United Nations, and it basically focuses on the health of the entire world. Their objective is to attain by all peoples the highest possible level of health. It was established in 1948, and it contains 192 members. They are part of what they call the World Health Assembly. They have several major jobs. One of these is to monitor disease worldwide. They actually contain multiple statistics that people can access information about. It has multiple fact sheets and lists, including top 10 deaths, top 10 disabilities found throughout the world, rate of blindness in certain areas of the world. Anything that you could possibly imagine, you can find this information on the World Health Organization page. It also sets international standards of health and safety. It assists member nations with disease control. They actually will monitor certain disease outbreaks, and they can go in there and help control. They can help provide services to maintain any outbreaks within that particular area of the world. This also plays a huge role in monitoring portions of health, including monitoring pollution. It helps assist underdeveloped nations with pollution control and coming up with solutions that can increase health statuses of different citizens found throughout the world. We're going to move just a little bit smaller and more local to the Department of Health and Human Services. This is found in the United States, and this is the overarching government body that organizes the various health and welfare agencies that the government provides. Its major objective is to enhance and protect the health and well-being of all Americans. It's the largest public health program in the world. It includes over 300 programs and has more than 77,000 employees within its different programs. It provides all sorts of services: health and social science research. It has immunization services. It looks at food and drug safety, so it actually goes in and it will ensure that the food that you eat comes from a safe environment. They check for different facilities that do produce our food, that produce our medications, to make sure that they're providing the safest possible forms of food to the public. And they also have essential services for those who are least able to help themselves. These are the different services that are provided underneath the Department of Health and Human Services. It includes your Medicare and Medicaid to help pay for medical costs for those with lower income, the Centers for Disease Control and Prevention, the National Institute for Health, and the Agency for Healthcare Research and Quality. This plays a huge role in looking at the health and social sciences research that the government can provide. And of course, the Food and Drug Administration, just ensuring that we have safe foods and safe pharmaceuticals for our population. Then you have even smaller level, your state health departments. In Missouri, it's the Department of Health and Senior Services, the DHSS. Anytime you go to a local level, you're going to see services and programs that vary widely from state to state. The idea behind this state to state is that it's directed by the health commissioner of the state, or they can actually have a secretary of health that's appointed by the governor, and it's focused on the needs of that particular area of the country. So the Missouri Department of Health and Senior Services was established in 1883, so it's been around for quite a while. Its entire mission is to protect and promote the quality of life and health for all Missourians. Do you see a theme here with all of our services? It's developed and it has implemented programs that allow for information and education, especially to people in the lower income range. It helps with regulation and oversight of different healthcare priorities for different populations. It provides quality services, and it helps survey disease and conditions, and it looks for breakouts of certain diseases and helps control and figure out how to stop these breakouts from moving into a different population. And last, but certainly not least, we're going to look at the local health departments. And this is what affects the majority of people working within your particular local area. So where we live, it would be the Springfield-Greene County Health Department. Services, once again, vary widely depending on how the local institution decides to govern their local health department, usually directed by a health officer or administrator that's appointed by local leadership within the community. And its focus is the citizens of the community. So once again, we're going to see a pattern emerging for these different health departments. But for the local setting, it really does work on monitoring communicable diseases. It's looking at the incidence of these diseases, the prevalence, and how to prevent these diseases from spreading in the community. Helps prevent illness. Lots of ways that local health departments do this. They can provide different screening like tuberculosis screening, lead poisoning interventions, STD screening. Our local health departments also supply water, well inspection, restaurant inspections. They can also provide direct patient care, prenatal care, well child checkups. And lastly, but certainly not least, they provide educational tools to help promote health within the community. So programs are available to local citizens as well. They provide direct care for people living in rural, isolated areas or those with low income who are unable to see a provider outside of the public health realm. And other partners in public health, these are just very generalized areas where you will see public health promoted. And one of these partners is the media. This is where health education promotion can be utilized via the news, via social media. This is where communication about different disease processes, how to prevent diseases from spreading, really helps occur and spread from one group to another, from one population to another. So education really follows in that media. Employers and businesses, this is where you see employers providing health insurance for their employees. They also have started, especially now, really providing wellness initiatives and benefits for staying well to help decrease the cost of insurances and promoting healthy workplaces. Government agencies play a role in providing education to their population through the local health departments. They also develop policies to help with restaurant inspections, well water inspections, lead poisoning inspections, all of these things that we utilize throughout our community. They also will help with city planning to help ensure that they create an environment that's safe and healthy for all of those living in their community. Academia, of course, this plays a role in educating the population about health risks and healthy habits, training, research, public service, getting knowledge for health spread out to the community as a whole. So let's go ahead and take a few minutes and look at our NCLEX knowledge check for this unit. Did you get it right? When you look at all the answers for this NCLEX knowledge check, I want you to be aware of what the nurse's role is. It's just to understand what each agency and organization provides, to know what kind of health laws are available and what health laws you have to follow, and how to work within the community to coordinate services to address the needs. You might see other interventions such as blood lead screening programs, educating local health providers, testing children, and working with landlords to help decrease the exposure of lead. So it's all about using the resources that are available to you to help increase and promote the health of a community as a whole.